everyone, and welcome. You're watching Eagle News America. I'm Anna Kui, coming to you from Las Vegas, Nevada. It is Sunday, April 11, 2021. Tonight, we have updates from several of our correspondents across North America. In Ontario, April Masongsong reports about vaccine eligibility in Toronto's COVID hotspots. In Edmonton, Alberta, Bureau Chief Thomas Likeness.
Critical care specialist in Canada's largest province warns they may have to start rationing ICU beds.
Bureau Chief Mila Simbulan in Swarthmore, Pennsylvania.
Pennsylvania Department of Agriculture reminds Pennsylvanians of the benefits of kennel inspections for quality dog breeders.
Eagle News correspondent Lori Jarvina joins us tonight.
City of Las Vegas senior centers reopen.
In Atlanta, Bureau Chief Philip Toledo tells us about Georgia now open for business. In Baton Rouge, Monique Velasco tells us about the state of Louisiana announcing April as Child Abuse Prevention Month. In Guam, Irishdale Radam takes us horseback riding. Plus, for tonight's roundtable, April 11 is National Pet Day, and we will be sharing stories about our dear pets. Our coverage begins now. State Department spokesman Ned Price said Thursday the country was providing another $152 million to prevent potential famine in Ethiopia's conflict-hit Tigray region as it urged unhindered access.
Today, the United States government, through USAID, announced more than $152 million in additional humanitarian assistance to help the people affected by the crisis in Tigray's Ethiopia's Tigray region. This announcement of additional funding brings the total U.S. humanitarian assistance for the Tigray response to $305 million since the crisis began in fiscal year 2020.
The agency urged other donors to step up contributions immediately, pointing to UN warnings that there could be a risk of famine. It said in a statement, the United States remains deeply concerned about the ongoing humanitarian crisis in Tigray and the lack of sufficient humanitarian funding to address it. Large-scale assistance is urgently needed to prevent conditions in Tigray from worsening. Price called for full and unhindered access to Tigray.
We also must take this opportunity to raise that as more information comes to light regarding the scope of human rights violations, abuses, and atrocities, assistance and protection of the most vulnerable is more important than ever. We are deeply concerned by the violence in Northern Ireland, and we join the British, the Irish, and the Northern Irish leaders in their calls for calm. We remain, as you have heard us say before, steadfast supporters of a secure and prosperous Northern Ireland in which all communities have a voice and all communities enjoy the gains of a hard-won peace. As the United Kingdom and the EU implement Brexit-related provisions, this administration encourages them to prioritize political and economic stability in Northern Ireland. As I said before, President Biden has been unequivocal in his support for the Belfast and Good Friday Agreement.
Blinken has spoken of ethnic cleansing in Tigray, where Eritrean troops are also intervened to fight. Jake Sullivan, the National Security Advisor, pushed for expanded humanitarian access in a telephone call with Ethiopian Deputy Prime Minister Mekonnen. Spokeswoman Emily Horn said Sullivan also pressed on the promised departure of the Eritrean troops and sought an investigation into atrocities. Here's today's COVID-19 numbers. According to the Coronavirus Resources Hopkins University in Medicine, as of 6 p.m. Eastern Time Sunday, April 11, 2021, the number of cases of COVID-19 reported worldwide is now more than 135,766,000. Top 3 on the list of countries with recorded cases: U.S. more than 31.1 million, followed by Brazil more than 13. India more than 13.3 million. This virus has now already claimed more than 2,932,000 lives worldwide. Top 3 countries again with the most number of COVID-19 related deaths are U.S. more than 562,000, Brazil, more than 351,000, and Mexico, more than 209,000. And now for COVID news. Matthew Hua and Anna Lander, two students at Georgetown University in Washington who are immunocompromised and at risk of severe complications from COVID-19, were vaccinated against the virus earlier this year. They say vaccination felt like a relief, although they still follow public health guidelines and have not yet resumed all the activities that they were able to do before the start of the pandemic. Take a look.
I was so excited. I said to her, well, what are you going to wear? Are you going to wear a dress or are you going to wear sweats? And she said, probably just wear sweats and a jacket. I was like, you might want to wear a vaccine outfit, because we were so excited. The reality, it was like an 8 a.m. vaccine, so I put on sweats and a jacket and just went. I'm still taking classes at home. We see family members in the garage, distant. We haven't had a meal at the same table yet, but we're looking forward to it. And then with friends, happy to see them, but until they're vaccinated, still have to have masks. And even then, I'm not sure if hand sanitizer is going away anytime soon. I've also felt more comfortable driving. Not that I couldn't drive during the pandemic, but now I have places to go. And having a place to go is so much more fun than driving aimlessly for me. And so I had a destination, I had a place to go, and I see the light at the end of the tunnel for me.
I happened to get a leftover vaccine at my local grocery store. They had leftovers at the end of the day, and I said, absolutely, I would love one. So I got vaccinated simply by chance, not due to the advocacy that I and others were doing, just a few weeks before people in my cohort of high-risk individuals were actually made eligible. I celebrated 2 weeks after the second dose, when I was truly classified as fully vaccinated, by going to a museum in DC that had just opened up, and that was kind of my first foray into going back into the real world. And it was really lovely. It was a great feeling. I haven't changed my routine quite yet. You know, for example, with my personal care aides, we're both still masking, even though we are both vaccinated. Especially just because the other two people in my household aren't vaccinated, and I want to be conscious to protect them. But this does feel like the beginning of moving back to changing my routine in a way that is more normal, more post-pandemic, and whatever that might look like. So I'm really looking forward to that.
With the COVID-19 vaccine now available for all adults in Texas, vaccinating students is one of the priorities in dealing with the virus. After more than a year, some students are no longer following safety guidelines and are becoming super spreaders.
Students make up a large percentage of super spreaders. They go out, and a lot of times they ignore guidance from the CDC and other health departments. And so they'll go out and they'll party, they'll do things that college kids normally do. And so it's really important to vaccinate those college students so that...
But there are still some conservative views on the vaccine. I do have some friends that are very reluctant to take it. They have some absurd theories as to what is in the vaccine.
At the University of Houston, vaccination centers have been set up on campus to encourage students to get the jab. Vanessa Astros of St. Luke's Health Group says these centers are very accessible. Take a look.
It's pretty accessible, not just for the community at large, but also for students, because for them it is pretty convenient. They know where it is, and they can quickly make their appointments and get their vaccine. It's important for the young population to get vaccinated as schools start reopen for in-person teaching.
And for those who already received their vaccine, this means going back to a better learning setup, which is in person.
I'm really excited to have gotten the vaccine, so I'll be able to see my peers and have study groups and be able to meet in person and have classes together. I think online classes have been isolating, and we haven't been able to learn as well in our dorm rooms instead of the classroom.
In Washington, this week, Mayor Bowser and DC Health announced that beginning tomorrow, Monday, April 12, all DC Residents 16 and older, Monday, April 19, all DC residents 16 and older will become eligible to receive the COVID-19 vaccine in Washington, D.C. In order for D.C. to get the vaccine out as efficiently as possible, Mayor Bowser is calling on all D.C. residents to pre-register for a vaccination appointment by going to vaccinate.dc.gov or calling 1-855-363-0333. Since the pre-registration system launched, more than 66,000 individuals have already pre-registered, received an invitation, and booked an appointment. To date, approximately 192,286 individuals have pre-registered for and are awaiting an appointment. Individuals who previously pre-registered for an appointment through the portal and who have already received their vaccination elsewhere can email vaccinatedc@dc.gov or call 855-363-0333 to have their information removed from the pre-registration list. Eligible DC residents are also reminded of other ways to make an appointment, including directly through their healthcare provider. Veterans and veteran spouses can get vaccinated through the VA Medical Center and can learn more by calling 202-745-4342. DC residents 65 and older, teachers and school staff, child care workers and healthcare workers can book appointments through the CVS site when appointments are available. In other news, raising suggestions that they were killed by sea pollution, officials said Saturday 2 dead whales have washed up on the same stretch of Bangladesh coastline in 2 days. Officials said the second, much longer whale washed up on Himchari Beach outside the resort city of Cox's Bazar at around 8:30 a.m. Saturday, just a day after the carcass of another bride's whale was found 1.25 miles from the spot. Jahirul Islam, executive director of the Cox's Bazar-based Marine Life Alliance, said the carcass of the whale found today is at least 50 feet long and 10 feet wide. It weighs 3 to 4 tons. Islam said the whales could have been killed in a collision with a ship plying the Bay of Bengal or have died after eating plastics which litter the sea. Islam said primarily the two were thought to have died from consuming plastic and polluted objects. There is an injury mark on the back of the second whale. We suspect it could have been hit by a high-speed vessel. Mohammed Shahidul Alam, a professor at the Institute of Marine Science and Fisheries, said parts of the Bay of Bengal are seriously polluted and that could have led to the animal's demise. A spokesman for Bangladesh Environment and Forestry Department said its researchers had collected samples from the carcasses for post-mortem examinations. 2 similar whales also washed up on Cox's Bazar beaches in 1996 and 2006. Up next, updates from Ontario, Alberta, and Pennsylvania. Eagle News America continues.
Hey there, Arnie Aquino here at Hatley Castle, one of the filming locations for the X-Men series. Don't forget to tune in to Digital Nest only on Net25.
Factual.
We have to defeat the virus everywhere.
Timely information. Balanced, not only in the country, but also abroad.
I'm certain of one thing.
Interviews that people need to know. Watch Aguila Pilipinas. A 1-hour newscast of reports coming from regional hubs in Luzon, Visayas, and Mindanao. Know the important updates in Asia in ASEAN in Focus. Track the latest stories in the provinces in Aguila Provincia. Tune into Mata ng Aguila, the evening primetime news program of Net25. Balanced and objective, Mata ng Aguila covers national and international issues, tackles news on business, health, science and technology, entertainment, sports and human interest features, and current events. And Eagle News International delivers the latest global reports, impartial, accessible, and up-to-date. It brings to fore EBC's rich international scope and access to valuable information streams.
Well, thank you to our help outdoor.
Catch these programs on Net 25. You can also watch our news programs through eaglenews.ph and Eagle News Facebook page and YouTube channel. Start up your weekday mornings with edutainment, news, and information kasama ang inyong paboritong Net 25 shows. Samahan ang inyong paboritong morning barkada sa Pambansang Almusal at 5 a.m. Tatalakayin mga pangunahing balita sa pagtutulungan ng Radyo Agila at Net 25. Samahan si Weng de la Fuente sa Balitalakayan, 7 a.m. sa Ganang Mamamayan at 8 a.m. NHK World at 9 a.m. Eagle News International at 10 a.m. At mga balitang dapat niyong malaman mula sa Agila, Pilipinas at 11 a.m. This is your morning startup every weekday mornings only here on Net 25.
You're watching Eagle News America. I'm Anna Kui in Las Vegas. If you are 50 years old or older and living in a COVID-19 hotspot in Toronto, Ontario in Canada, you may now book your vaccination appointment. Eagle News correspondent April Masongsong reports.
Vaccines will now be available and be made accessible to even more Toronto residents in the coming days. Let's listen to the mayor, John Tory.
Our public health officials have been clear that we must all focus our efforts on hotspot neighborhoods in our city, and the easiest way for people to understand that and to access a vaccination is by postal code. So we are working with the hospitals and other healthcare teams and with our own city teams to operate more mobile and pop-up vaccine sites in hotspot neighborhoods as soon as possible. We have to get shots in arms in areas where they're needed the most.
Toronto residents 50 and older and living in a COVID-19 hotspot are now able to book vaccination appointments at any mass immunization clinic. According to the City of Toronto, hotspot areas are neighborhoods identified by the Province of Ontario with ongoing and historic high rates of COVID-19 transmission, hospitalization, and death. These areas were also identified by the province to have populations with higher risk factors, including racialization, income, quality of housing, immigration status, and education attainment. Currently, 53 areas in Toronto are considered a COVID-19 hotspot. If your postal code starts with the following and you are 50 years and older, you are eligible to book a vaccine appointment. You may also call the vaccine information line at 1-888-999-6488. The city will also be utilizing mobile clinics and pop-ups in addition to hospital and immunization clinics. 3 more city-operated vaccination clinics will open in Toronto on Monday. Cloverdale Mall at 250 The East Mall, North Toronto Memorial Community Centre at 200 Eglinton Avenue West, and Carmine Stefano Community Centre at 3100 Weston Road. Depending on supply, all city-run clinics aim to administer 10,000 doses per day. To encourage Ontarians to get vaccinated, Premier Doug Ford got himself vaccinated Friday with the AstraZeneca dose. Dr. Eileen Davila, Toronto's Medical Officer of Health, implores everyone to get vaccinated and continue to follow public health measures.
That's a simple standard to measure. Fewer cases, less spread, more vaccines. We've got to get this done. There is not enough vaccine, nor enough time to vaccinate our way to the other side of this latest, overwhelming wave. So please, abide by the stay-at-home order. Practice self-protection measures. Get your vaccine as soon as you are eligible. In so doing, everyone in Toronto will be better protected, safer, and ultimately healthier.
Ontario reports its highest case count Friday with 4,227 new COVID-19 cases, the province's second most reported daily cases since January 8th. In Toronto, April Masongsong, Eagle News. We live in interesting times.
Thank you, April. We appreciate the update. In related news, a critical care specialist in Toronto warns that ICU beds might have to be rationed in the province of Ontario due to the rapid spread of COVID-19 infections there. Bureau Chief Thomas Likeness is with us tonight with the details. Thomas?
Thank you, Anna. Well, you know, Canada's largest province, that's Ontario. Not good there. They're in dire straits these days. You know, with variants now the dominant causative agent of COVID-19 in Canada, that virus is spreading rapidly. We're seeing case numbers bigger than the ones that occurred at the height of the pandemic. You might recall those last year this time. Ontario posting daily case counts of above 4,000. And because these variants cause more severe symptoms, hospitals are filling up. Dr. Michael Warner is the director of critical care at a Toronto hospital. He took to Twitter on the weekend with this warning. Warner says, unless the province's hospitals get more help, they'll find themselves in a triage situation when it comes to assigning ICU beds. So what does that mean? Well, basically, when two patients needing critical care show up at the same hospital and there's only one ICU bed, the one most likely to survive, well, that's who's going to get the bed. And we're not just talking about COVID patients here. These could be patients suffering from any condition, be it a medical condition, you know, like a heart attack or something, trauma from an accident, anything. Warner wants the federal government to eliminate barriers so it would be easier for healthcare professionals from other provinces to help out in Ontario. He says, you know, nurses and others could be transferred from other regions where the pressure on hospitals is minimal. Part of the challenge, though, of going to another province is the time it takes to satisfy the licensing requirements of the new jurisdiction. Now, here in Alberta, we're weeks away from being in the same situation as Ontario if things don't change. Case numbers here are approaching last year's levels, and we're being warned that ICUs are starting to fill up. We're in the unfortunate position of not having enough vaccine to immunize enough people to keep those variants at bay. Provincial governments up here have responded to the outbreaks with increased restrictions, but, you know, sadly, more and more people are choosing to ignore them, at least here in Alberta. And let's face it, the country is suffering from epidemic levels of COVID fatigue. A few restaurants here in Alberta are refusing to shut down as ordered to on Friday. And I fear, you know, that as more businesses revolt, that rebellion will become contagious, just like the virus, and others will feel emboldened. You recall that church I told you about last week in Alberta that was shut down because it repeatedly defied public health orders? Well, there was a rally there today at that venue, attracting some 400 people, many of them from out of province. And sadly, though, those actions affect the people that follow the rules because they're at increased risk of infection now because of the antics of these so-called freedom fighters. No matter what people choose to believe, the truth is the variants present a huge danger. Not only are they more contagious and cause more severe symptoms, very few people in Canada are protected against them. We simply don't have enough vaccine to immunize a significant portion of the population. I just hope the good doctor, Dr. Warner, who sounded the alarm about the triage, I just hope that he's wrong, and I'm sure he does too, because it's not a situation anyone wants to be in. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times. Back to you, Anna.
Thank you for the update, Thomas. Unsettling as they may be. I mean, it's really hard to imagine a third wave being much worse than the first two, but it's there. It's what's happening. Last year, the situation in Canada was nowhere near as bad as it was in the U.S. I mean, just how bad is it?
Anna, first of all, I want to put the numbers into context. We have 10% of the population that you have, and we're averaging about 7,000 new cases a day. Now, today, the United States reported just over 64,000 new cases. And as I said, we reported 7,000. So, yeah, no, we must be doing pretty good. It seems small until you look at the rate of infection, the rate, not the actual number. Now, let's do the math. Again, at a tenth of the population, our 7,000 would be like 70,000 if we had the same number of people as you do in the U.S. And consider also that we have a tenth of the healthcare resources that you do. So when you put those numbers into context, our average of 7,000 cases a day puts us in a more serious position than your 64,000. And then you have the added advantage of having, what is it, close to a quarter, Anna? Close to a quarter of the population that's been vaccinated. Up here, yeah, up here, less than 2% of Canadians are fully vaccinated, and about 15% have received at least one dose. Anna?
Yes, that's really what needs to be done, right? I mean, the vaccine, as we've been hearing, you know, there's a race between the vaccine and the variant. The vaccine has to win. But I understand doctors are recommending some...
One by a long shot here.
But I understand doctors are recommending some changes in the vaccine rollout there. What can you tell us about that?
Well, Anna, a study I read in last week's edition of the Canadian Medical Association Journal says we should have a more nuanced way, that's their word, a nuanced way of deciding who gets vaccinated first. You see, up until now, it's been age-based. But this study suggests that 3/4 of Canadians have at least one risk factor, whether it be, well, diabetes, a heart condition, obesity. There's just dozens of things. Then we get into factors such as communities, occupations. And what the docs are saying is, you know, we've already immunized the most vulnerable older Canadians. So before we immunize anybody else, let's look at who should be next and consider factors other than age. Because again, in crowded communities, in crowded workplaces such as warehouses, meatpacking plants, those frontline occupations where there's a high risk of infection, these are the people that should go next, rather than somebody who's in good health, who may be working from home in a suburban community. You know, they're like me, a virtual hermit. I don't get out and see a lot of people. So really, for me, it's a low risk compared to somebody who's on the front line. You know, it's a whole issue of medical ethics, and this study certainly has some good suggestions. Anna?
Yes, I mean, that would make sense, right? Vaccinate the ones who are frontliners, you know, no matter what industry, as long as they're,
exactly.
You mentioned if they're around each other, crowded places, that would to have them vaccinated first. But you also mentioned, Thomas, that church that was closed down last week by the government. What can you tell us about the gathering there today?
Okay, Anna, and first I want to be clear, the government has not outlawed in-person worship services. It just puts conditions on them, 15% attendance, you know, according to the building's capacity, social distancing, masking, that sort of thing. They never, in this province, outlawed in-person worship services. But this particular evangelical church regularly packed its services with 300 plus people and ignored all of the other rules. So last week, the government put up a fence, actually double fenced the property, blocking any access to that building. You can see it up there on the screen. There's the notice. We shot this footage yesterday. Only a few people were protesting at the time. Police are remaining on the site around the clock to prevent anybody from entering the building. Now, this morning, about 400 people showed up, and most of them were not churchgoers at all, but they were people with a political axe to grind. You had the anti-maskers, the conspiracy others. They remained outside of the fence, but at one point, some of the protesters tore down some of the fencing. The church issued a statement saying its members were not involved in the protest. That fence, incidentally, is going to remain up until that organization can show that it will comply with health restrictions. Anna?
Thank you, Thomas. It's always those who have more time in their hands to be...
Yeah, professional protesters. I think we've had them all of our lives.
Yes, absolutely. Well, Thomas, hang in there. We hope to, you know, hear better Better numbers, better news coming soon out of Canada.
We remain hopeful up here, and do stay safe down there. And I'm still looking forward to getting down to Vegas one of these days.
Yes. NAB, Thomas. It's coming, October 2021.
I'll be there.
Thank you. In Pennsylvania, dog breeders are reminded about the benefits of kennel inspections. Bureau Chief Myla Simbulan tells us why. Myla?
That's right, Anna. The Pennsylvania Department of Agriculture reminds the public that the Bureau of Dog Law Enforcement provides a useful tool for consumers considering getting a puppy or boarding a dog. The kennel inspection search allows anyone to see the most recent dog warden inspection reports on local kennels. It is searchable by county, kennel or kennel owner name, city, or zip code. The value of this service to both Pennsylvania consumers and small business breeders is in jeopardy, as the Bureau of Dog Law Enforcement faces insolvency without a legislative fix to raise the dog license fee. Here's Kristen Don Moyer, Director of Bureau of Dog Law Enforcement, to tell us more. Take a look.
By law, Pennsylvania dog wardens perform a minimum of 2 unannounced inspections per year on licensed kennels. These inspections provide an opportunity for wardens to ensure proper living conditions and check the overall well-being of the dogs living there. Dog wardens are the eyes and ears for dogs in kennels. We are the only agency that can enter a state-licensed kennel without a search warrant. Wardens are the first line of defense in preventing animal cruelty in kennels.
The Bureau of Dog Law Enforcement is funded mostly through the sale of dog licenses, but it can no longer support itself. The license fee has not been increased in 25 years. The Bureau has been forced to make tough financial decisions, including keeping some dog warden positions vacant and conducting fewer kennel inspections. Currently, 46 dog wardens are covering Pennsylvania's 67 counties. Here's Fred Stratmayer, Deputy Secretary of Plant Industry and Consumer Protection. Take a look.
Over the past year, we saw Pennsylvanians rely on dogs for companionship and comfort at a time of stress and uncertainty. They truly bring joy to our lives. At the Department of Agriculture, our Bureau of Dog Law Enforcement, which is funded mostly through the sale of dog license fees, promotes the health and safety of dogs in kennels through inspections. But the dog license fee has been the same $6.50 for the last 25 years, and now the Bureau of Dog Law can no longer support itself on those funds alone.
Small kennel businesses depend on frequent kennel inspections and industry regulation to keep standards high, verify their good reputation, and to help shut down bad kennels. Although the number of kennels keeps growing, dog wardens are spread thin, so they are conducting fewer inspections. That puts dogs at risk. Normally, dog wardens serve neighborhoods across Pennsylvania by capturing dogs running at large, helping dog owners track down a runaway best friend, and investigating dog attacks to provide justice for victims. These services are in addition to their mandated work to inspect nearly 3,000 kennels and breeding operations in Pennsylvania. Since its enactment in 1893, enforcement of the dog law has been funded through the sale of dog licenses. Now, taxpayer dollars are being redirected to the Bureau to keep the minimum mandated services up and running. For the 2020-2021 budget year, the Bureau accepted a supplemental transfer of taxpayer dollars in the amount of $1.2 million. Another $1.5 million is proposed for 2021-2022 year. Taxpayer dollars are now paying for dog-related services at the local government level too, as wardens become more strained and calls for strays and dogs at large default to local services. Without immediate action of passing a fee increase, the frequency of kennel inspections will decrease. This will put both consumers and Pennsylvania small businesses at risk. Right now, Anna, here in Swarthmore, it's 52 degrees Fahrenheit or 11 degrees Celsius with cloudy skies. In Swarthmore, Pennsylvania, Myla Simbulan, Eagle News, We live in interesting times. Back to you, Anna.
Thank you, Myla. Nice and cool out there. Now, what has been done in order to alleviate this issue on providing kennel inspections there in Pennsylvania?
So our state senator, Judy Schwank, and state representative, Eddie Day Pashinsky, they have introduced two corresponding pieces of legislation. One is Senate Bill 232 and House Bill 526. This is to raise the dog license fee by a minimal amount that would adequately fund the Bureau to continue protecting both dogs and the public here in Pennsylvania. Anna?
Oh, well, that's good. So, I mean, what else is included in those bills?
So the minimal fee that was mentioned, it's a minimal fee increase. For example, if for a spayed or neutered dog, the increase would be from $6.50 to $10 annually. And this will benefit Pennsylvanians at large. The bills will also require puppies to be licensed at 8 weeks, the same age they are legally allowed to be sold. This is expected to increase license sales of puppies and, further establish the Bureau. This proposed fee increase is in line with standard inflation and will fund the work of wardens to ensure humane treatment of dogs, investigation, and tracking of dangerous dogs. Anna?
It's hard to imagine that it hasn't been raised. Like, it stayed the same, $6.50 in 25 years.
Yeah, 25 years. No.
And and every little bit will count, right? I mean, every dollar, every cent at that, I mean, will help that. Now, last question, Myla, and I promise I'll let you go. If I'm planning to get a dog there in Pennsylvania, how do I check if the kennel has been properly inspected?
So you can go to Pennsylvania Department of Agriculture website, www.pda.pa.gov, and look for kennel inspection search. And you will find all those kennels out there. And there's details on when it was inspected and what are the things that were inspected. Anna?
Well, good to know. Well, thank you, Myla. That will go in line with our roundtable discussion at the end of the show.
I know.
We'll see you then.
See ya.
Still to come, stories from Nevada, Georgia, and Louisiana. This is Eagle News America. Stay with us. This is Eagle News America. I'm Anna Cui here in Las Vegas. Good news for senior residents in the city of Las Vegas. Senior centers have reopened. Eagle News correspondent Lori Jarvina reports. Lori?
Thank you, Anna, and greetings to all our viewers in America and abroad. Here in Las Vegas, our city is known to welcome visitors from around the country and around the world as a top destination spot for tourists, as the iconic Welcome to Fabulous Las Vegas sign comes to mind. But Las Vegas also wants to welcome back locals, too. The city of Las Vegas is happy to announce that senior centers are reopening, inviting active adults ages 50 and over to discover the fun in 2021 by visiting any one of the many senior centers beginning Monday, April 12th. According to worldpopulationreview.com, Las Vegas is the largest city in Nevada and the 25th largest city in the United States. In addition to being called the entertainment capital of the world, Las Vegas is a popular retirement destination. In fact, the state of Nevada often appears in top 10 lists for the best places to retire. Las Vegas is home to about 95,000 senior residents. So closures of senior centers due to COVID-19 impacted many of these residents. But the good news is they are now reopening along with community centers. Residents are invited to visit during operating hours to take a tour and learn more about the facility and programs. In addition to senior centers, Las Vegas parks and recreation centers are also now open to the public. This includes playgrounds, skate parks, exercise and fitness stations, and community pools, just in time for the heat. I think swimming is a perfect way to get your exercise in while also cooling off. And as you know, Anna, residents of Vegas don't need to wait for the summer months to experience warm weather. It's actually been in the 80s already and definitely approaching the 90s. I am looking forward to keeping the good weather and the good news coming with the reopening of local facilities as we continue to welcome back residents and visitors alike. In Las Vegas, Nevada, Lori Jarvina, Eagle News. We live in interesting times. Back to you, Anna.
Thank you, Lori. You mentioned the weather. You're absolutely right. We don't. I'm jealous of those who experience spring in some parts of the country. We actually just jump into summer, right?
Spring for about a week, Anna.
Now, do you know how many seniors or retirees we have here in Las Vegas?
Well, I was just actually looking at some recent statistics regarding COVID vaccinations, and we have quite a few of seniors and retirees here. So by age, 60 to 69 of the age group is 58% vaccinated. And great news, age 70 and above, they're actually at 79% vaccinated. Anna?
That's great news. You know, especially with the senior centers opening up, I'm sure they'll be more comfortable knowing that there's a large percentage of them already being vaccinated. Now, I know you take your kids to the park quite often, right? Have you noticed any changes?
So speaking of being comfortable, yes, we are absolutely, you know, getting more comfortable knowing that there's a larger population of people being vaccinated. And at the parks, as mentioned, they're opening, everything's opening up again. They put back the basketball hoops. So myself and my kids were kind of excited about that. We definitely do see a lot more families out there, so that's good news as well, Anna.
Yes, I noticed. I mean, just driving around the neighborhood, you know, you see a lot of people out there in the park. They're just happy to be out there, have the kids run around. Now, with Vegas opening up, it's pretty much open. What have you started to do, Lori?
Well, we do, you know, drive around and just look at, you know, places we can go, things we can do. Restaurants, definitely. I still get takeout. But like last time I reported, I finally saw a friend and ate at a Korean barbecue, which was very open air. And actually, I think it's the perfect type of restaurant for these COVID conditions because the ventilation is great. You're separated already. So, you know, again, if you ask me, what I'm looking forward to is eating out and eating more good food. Anna?
Absolutely. Well, I mean, you know, if you drive around town, I still see a lot of restaurants that have the outdoor dining area. So that's always something to consider. I think, you know, I'm thinking that's probably something that it's gonna stay, hopefully.
Yeah, I definitely think the successful ones have the outdoor dining area. Yes, Anna.
Yes. Thank you, Lori, for the update. And we'll see you at the end of the show for our roundtable discussion. In Georgia, the state is open for business. In Atlanta, Bureau Chief Philip Toledo tells us about restrictions there that have recently been lifted. Take a look.
Thanks. The sun is shining, spring is here, and as of Thursday of last week, the state of Georgia is open for business. Following the path of other states, an executive order from Governor Brian Kemp effectively rolled back pandemic-era restrictions that have been in place for just over a year. The order eliminates the ban on gatherings and any shelter-in-place requirements. It also removes the critical infrastructure distinction and consolidates required COVID mitigation measures. The distance requirements are also shortened for restaurants, bars, movie theaters, and others. The governor has cited a downward trend in COVID-19 cases and an increase in vaccine distribution as contributing to this decision. He encourages Georgians to not only get the vaccine, but also look to the future. Take a look.
And with all Georgians aged 16 and over now eligible to receive the vaccine, Dr. Toomey and I are encouraging everyone to roll up their sleeve and get their shot so we can continue making steady progress to return to our way of life in the Peach State. Georgians know the right thing to do. They know the best practices to protect themselves and their families. And moving forward, together, we will put our fight with COVID-19 in the rearview mirror. Because of our measured approach, our state has emerged from this crisis more resilient than ever. And from now on, our message is clear. Georgia is open for business.
COVID-19 cases and deaths are continuing a downward trend, and about 4.75 million vaccines have been administered to date. According to the State Department of Health, 30% of the population has received at least one dose, and 17% are fully vaccinated. Now, before I let you go, I have one other interesting bit of news. Last week, the governor signed another bill officially naming the pecan, or pecan, as the state nut. Aside from peaches, you might be thinking of peanuts when it comes to Georgia and are wondering why the peanut was slighted. Well, technically, peanuts are a legume, and that's a different category. In Atlanta, Georgia, Philip Toledo, Eagle News, we live in interesting times. Back to you.
Thank you, Philip, for that update. Governor John Bel Edwards of Louisiana announces April as Child Abuse Prevention Month. In Baton Rouge, Eagle News correspondent Monique Velasco tells us about events that organizations there are holding to raise awareness about the cause.
Thank you, and hello from Baton Rouge, Louisiana. Here in Louisiana, Governor John Bel Edwards recently shared a video on social media announcing that April is National Child Abuse Prevention Month.
Every April, communities throughout Louisiana and the nation observe Child Abuse Prevention Month by raising awareness of child abuse and neglect while promoting resources to support families. Communities that care about their children and families can work together to find solutions to this completely preventable issue. Our community cares. Get involved in preventing child abuse before it occurs. Let's work together, Louisiana, to protect our most important asset, our children. Thank you, and God bless.
Organizations like the Louisiana Children's Trust Fund recognize the importance of communities working to help families thrive and promote children's well-being while preventing maltreatment. During the month of April and throughout the year, communities are encouraged to increase awareness about child and family well-being and work together to create effective strategies that support families and prevent the abuse and neglect of children. This April, LCTF will be launching a virtual speaker series on April 14 and April 22nd. Its website, louisianactf.org, also includes outreach tools, publications, free graphics, and social media posts to help raise awareness about child abuse prevention. Other multimedia resources and videos can also be found on the website childwelfare.gov that can be used to promote the importance of strengthening and empowering families to prevent child abuse and neglect. Meanwhile, I hope you're staying safe and healthy in your part of the world. In Baton Rouge, Louisiana, I'm Monique Velasco, Eagle News. We live in interesting times. Back to you in the studio.
Thank you, Monique, for your report. Up next, tonight's roundtable, National Pet Day. This is Eagle News America. Stay with us.
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced. Eagle News, because we live in interesting times.
America. I'm Anna Cui here in Las Vegas. An American author once said, "Such short little lives our pets have to spend with us, and they spend most of it waiting for us to come home each day. It is amazing how much love and laughter they bring into our lives, and even how much closer we become with each other because of them." Today is National Pet Day. Let's ask our team here tonight their stories they'd like to share about how their pets have made or making their lives happier or more meaningful. So we'll start with Thomas.
I don't have a pet currently, but I had a German Shepherd dog back in the 1990s. He lived to be about 12 years old, and just a pleasure to be around. You see, he was obedience trained, and actually the local police department where I lived at the time helped me train him, not for protection, just obedience training. And he did have that protective instinct, though. Anyone I talked to on the street, he'd just stand between me and the other person. Also very, very protective of kids. Now, my daughter had a friend who used to hide out in our backyard when she didn't want to go home because she knew that dog was not going to let her parents into the yard, because any kid that came into the yard, that was his kid. So, but perhaps someday again we'll have a dog, and it would definitely be a German Shepherd with good obedience lines. Hannah?
German Shepherds are pretty big dogs, right, Thomas?
Oh, this guy was huge. He was about 120 pounds. He was a big dog, and just as gentle as can be. Just as gentle as
well,
can be.
thank you for sharing that with us. Now, Mila, do you have a pet? Or if you don't have one, if you did have a pet, what would it be?
So just like Thomas, and I don't have a pet right now. My daughter has been taking care of a fish, but I think it died recently. So, but then I used to have, when I moved from California here in Pennsylvania, since I am by myself, I'm single and by myself in an apartment, my first time to be by myself. So I decided to get a pet, the easiest one to take care of, and I decided to get a fighting fish or betta fish. I think that's what you call them. And I was because I'm a person who doesn't take care of plants because they usually die whenever I take care of them. So this is the first time that I have someone to take care of, a fish. And I'm just so glad after 3 years, he passed away. So yeah, just having this pet or this a being that I can take care of, and it took that long, is something that's memorable for me. Anna?
That's really good. 3 years. That's good. That means that you took very good care of it, Mila.
I tried my best.
Thank you for sharing that. Now, what about Lori?
So I didn't have many pets, Anna, growing up, but I do have one funny story that there was a neighborhood cat that we all kind of adopted. And I don't know who named it, but the cat's name was Senorita, and come to find out later it was a boy. So that was kind of funny. So with my kids, though, now, they've had, like Mila said, some betta fish and some goldfish. But once they can really prove they can take care of those, and they haven't, well, we don't have them anymore, so that tells you something. But then maybe, just maybe, we'll consider a more substantial pet.
Well, pets, they're just like kids. Before we go to Kathleen, quickly, my kids finally were able to get dogs just in the last, I would say in the last, 8 years. They keep, they've always wanted a pet, and I've always said no because it takes a lot of time. Like I said, it's just like another kid. So now we have 2 dogs, and they do grow on you. We have one long-haired Chihuahua and a Frenchie, and the Frenchie is a handful. He's just a puppy right now. He's about 2 years old, and our other dog is older. So I feel sorry for the other dog. It was supposed to be a companion for him, but as it turned out, he bothers him more than anything. So anyway, Kathleen, how about you? What kind of pets do you have?
Hi, Anna. Well, in the past, I've had cats. I guess because my nickname was Cat, so I tended to have cats. But last year, during the pandemic, my husband gifted me with a puppy, and this is Bebe Bechamel. He's a Bichon Frise, and I wanted to give him a French-sounding name because Bichon Frise is a French type of breed. So he is Bechamel is my favorite. I like a pasta sauce, so it's like because it's like made out of milk and butter, and he has like a light coloring. So this is Bechamel. We call him Bebe for short. He is gonna be 1 year old on May 16th. So his birthday is coming up next month. And you know, having him is like having a child, and he's very spoiled, and he's also very loyal, a very faithful companion. He follows me everywhere. We do everything together. When I'm working, he's my coworker, sitting beside me doing his own activities, and when I'm eating, he has to eat also at the same time. And whenever I have to go places, like he has such great separation anxiety, so I always feel compelled to come back. So this is Bebe Bechamel.
He is adorable. Now, Bichons, are they always that color? Because the ones that I've seen, they're always white. It seems like.
Yes, for the most part, they're white. They're distinctive by their white fur and their black eyes and butts and nose. So they look like, you know, kind of like a teddy bear. They look like a stuffed animal. But, you know, I've seen other Bichons, maybe some were, you know, mixed breeds, or I've seen some with, you know, like some other coloring. Anna?
Well, thank you for sharing. You said you call him Bebe?
Yes.
That's adorable. Now, Thomas, going back to you, you had a German Shepherd, and you said maybe you'll get another one.
Maybe someday. The problem is we're not doing it right now, but we like to travel. And if you go to another country other than the United States, you got to quarantine your dog. So I don't want to leave him for a month or 6 weeks when we go to the Philippines. It's, you know, unfortunately, I shouldn't say unfortunately, having a dog is like having a 6-year-old child.
Yeah, absolutely.
And I was just watching up there on the screen. I got a comment on that. I saw that bird wandering around the cat. You remember the Bugs Bunny cartoon and that big sloppy cat, Sylvester? And I was just thinking of that, with that bird wandering around. Tweety Bird and
see,
Sylvester.
right there with the bird and the cat. I do remember that cartoon. I wonder if that cartoon is still on somewhere.
Oh, it's still on, and you can get it up on YouTube as well. Once in a while, I have to have my fix of bugs.
Nice. Well, that's great news. Well, you know, during the pandemic, a lot of people have acquired pets, but now that they're going back to work here in Las Vegas, I heard about, you know, sad news that people are, you know, tending to leave dogs out in the park. They're just abandoning them.
That's just so wrong, so sad.
It is wrong.
Like,
so
you got to make that commitment when you have a pet. It's not, you're not buying a potted plant. You know, it's I don't
exactly.
Definitely.
Exactly. So I mean, so for those of you who are looking to get a pet, make sure to visit, you know, the Pound, the dog shelters, and you know, there's certainly a lot of them that needs a home. Well, thank you, team, for sharing your pet. Thank you. Bye bye, Bebe. So cute. Well, now it's time to thank our frontliners, first responders and essential workers, and our dear pet friends for making us smile. A much deserve a round of applause for everybody. We appreciate all of you for what you do. That is today's Eagle News America. Thank you so much for joining us. I'm Anna Kui, and we live in interesting times.